morning to all and one. Today we are discussing about the important topics on suicide preventions. Dr. Oves will read from my book Psychic Revolutions. Please go.
Thank you, sir. Thank you for taking me as a part of this video, and I am very grateful. Now we will continue with this topic. Suicide is major public health challenge. With more than 7 lakh deaths each year globally, each suicide has far-reaching social, emotional and economic consequences and deeply affects individual and community worldwide. The perennial theme for World Suicide Prevention Day for 2024-26 is changing the narrative on suicide. These themes aim to raise awareness about the importance of reducing stigma and encouraging open conversation to prevent suicides. Changing the narrative on suicide is about transforming how we perceive this complex issue and shifting from a culture of silence and stigma to one of openness, understanding and support. This theme also emphasizes the need to prioritize suicide prevention and mental health in policy making, calling for government action. Challenging the narrative requires advocating for policies that prioritize mental health. The narrative requires advocating for policies that prioritize mental health, increase access to care and provide support for those in need. World Suicide Prevention Day was established in 2003 by International Association for Suicide Prevention in conjunction with WHO. This 10 September each year aims to focus attention on the issue, reduces the stigma and raises awareness among organizations, government and public, giving a singular message that suicide are preventable. What is suicide? Suicide is derived from the Latin word for self-murder. It is self-inflicted death with evidence, either explicit or implicit, that person indeed to die. There are some other related items which are as follows. Suicide attempt, which means self-injurious behavior with a non-fatal outcome with evidence that person intended to die. Parasuicide refers to the patient who injures themselves by self-mutilation but does not wish to die. Suicidal ideation are thoughts of wanting to die which may vary in seriousness. Suicidal intent, subjective expectation and desire to end one's life. Lethality of suicide behavior is the danger to life associated with particular method of suicide. Now steps. To check suicide or self-damaging tendencies, suicide affect people of all ages, caste and religion. When person become hopeless and feel that now I can't do anything, I am finished, he feels suicide is the only way for him. Depression is major risk factor for suicide. Now what are the risk factors? Male gender, youngster and elderly, past history of suicide, poor social support, long-term incurable illness, loneliness in life, depression, addiction, example alcohol, delusion and hallucination, divorced or widowed, unemployed, chronic illness, frequent and intense prolonged suicide attempt, poor insight, socially isolated, unresponsive family. Now how to assess severity of the suicide tendency? To talk with person and encourage him to ventilate completely. Ask for following question. How was your life? Now how is your life? Are you feeling that it is better to die than live such life? Have you any suicidal ideas or planning? Ever attempted suicide or not? If anyone tell you, I want to die, take it seriously. And if you feel any suicidal tendency, consult psychiatrist and ask for help. How to help people with suicidal tendency? Emergency consultation of mental health doctor. Talk to him with calmly and freely. Let him ventilate. If required, then admission to the hospital and treatment of the psychiatric illness. Not to leave patient alone. Not to keep anything which can harm him besides him. Not to prioritize him and give him support. Now step 2. To listen him. Let him ventilate completely and share his feelings, sadness and incidences. It will help a lot by decreasing tension. Step 3. Don't criticize him. Not to criticize that why do you do this, or are you mad, you have no mind, you can't do anything. Not to be in struggle with that person, but suicidal tendency is severe, then restrict him. Step 4. To give support and consultation. Do effort to install hope in that person. Tell him that that is not a big disease and can be cured with appropriate treatment. It is not black magic, not a sin, not like cancer, and not due to weak. Step 5. Advise to consult and take treatment from mental health professional, psychiatrist, like number 1 psychiatrist, 2 clinical psychologist, 3 occupational therapist, 4 psychotherapist, 5 hypnotherapist, and also from family doctor, friends, family member, and social supporters. Step 6. To encourage self-help, he can take following step to help him: to read good books, to stop addiction, to use relaxation techniques, to take treatment properly with regular follow-ups, to share emotion with friends and family, to trust in God and himself, to participate in support groups. These are primary aids to support person with suicidal intention. Thank you.
Thank you, Dr. Proves. Nicely.
Thank you, sir.